depth and breadth of the Economic Opportunity Funders 2026 budget and tax briefing, where these funders had coordinated some incredible sessions. And so anyhow, this is a very brief, like literally 5-minute summary of all these conversations, plus the work that has been going on here in Massachusetts with the United Way, and really trying to look at what are we going to be possibly faced with in these months and years to come. So I get to do sort of more the depressing side, and then Kat will get to uplift you a bit more with the visioning side. So just hold on, it's going to be 5 minutes. So let's go. All right. So next slide. So this is, what is coming. So everybody knows in July, lawmakers passed President Trump's bill that was commonly known as the One Big Beautiful Bill Act, which ushered in basically $1 trillion in federal Medicaid spending cuts. So just to see a little bit more about what does that entail, if you go to the next slide. So this is where Medicaid will be reduced by $911 billion over 10 years. Millions of Americans will lose their health care and face medical debt. What that really looks like is that probably it's going to be around 5 million, but 78 million will be deeply affected. 6 in 10 are estimated to be people of color. And SNAP benefits will be really affected because they will be cut by $186 billion, which means about 20 million children and 3 million young adults who participate in SNAP and rely on these essential supports have the possibility of not having their SNAP benefits given. So what we want to look at is the next slide, which is, what does that really mean? So in different conferences I've been to, it really looks at 2 main things. Number one is the new law makes it just much harder to enroll and stay on Medicaid. They are counting on a lot of people who definitely qualify for Medicaid not being able to stay on it, and that the reporting requirements are going to be so sort of onerous that they are not going to be able, or they'll give up trying to be enrolled. This is where I feel like we can help. And number 2 is it dramatically reduces financings to the state from the federal government. We'll get into a little bit more about what that looks like, but it basically increasingly makes it more difficult for states to come up with those dollars that they need, because it has them increase their spending that they will need to spend in order to keep SNAP alive. So policy analysts warn that Medicaid cuts under H.R. 1 will also reduce access to behavioral health care, and we know what a mental health crisis we've been in for a very long time. It will increase crisis utilization and worsen workforce shortages. And we all know how this affects, healthcare affects public safety, economic stability, community vitality, all the things, right? So, and we know our creative youth development organizations very much hold all of these things. So that is why I think it is a really important topic for us to look at. One of the things to note is that, in 2027, states will need to begin to pay 75% of the cost of SNAP versus the 50% that many of them are paying. And this requires then states to start to have, because states can't have a deficit, the budgets will be slashed even further. And demands will increase also at the same time. So this is where 2026, not so much of a bad year, 2027, 28 starts to become much more difficult. Because basically there's no automatic federal backfill, and states will lose these sort of flexible federal dollars that they've been able to have. Okay, so next slide, we're almost done. Okay, so the key SNAP changes, most people are aware, but they will be expanding their work reporting requirements. People will be forced or saying like you can't get SNAP unless you are working 80 hours a month or having volunteer work. They restricts benefit level increases, they shift the cost to states, and they eliminate eligibility for lawfully residing humanitarian immigrants. So these are some significant changes, including even requiring homeless. I read about this, that if you're in a homeless shelter, you're still required to report on these 80 hours. Now, there are some exceptions, but right now they're very vague in terms of like what is deemed medically, are you too medically fragile to be able to work? So we're still waiting to hear exactly those details and what does that mean to qualify for different exemptions. The key Medicaid changes is a lot around more paperwork, new reporting requirements, higher out-of-pocket costs, cuts in reproductive health providers, and also restrictions on state taxes that fund Medicaid. All right, moving right along. So the timeline. When does this all start to happen? There's a reason why a lot of people don't quite know enough about it right now or haven't even been talking about it. And that is that the communication around this will really start to happen in June of this year. So that's when they're going to release the interim rule on implementing work requirements. And that's when sort of your state government gets a lot more involved in some of the messaging that will go out. Then in September, that's when the states are required to begin the outreach of new work requirements. And then in January 1st, this is where it hits. Now, what's important is that beginning in 2027, the work requirements go into effect and people will begin to really lose their benefits due to the paperwork confusion or the short gaps that they have in their work. And those that are ages 19 to 64 are going to be requiring to document these 80 hours of work a month. And yet we still don't quite know what does that mean. And for, especially artists who have like a lot of gigs or different workflows, like how is this really going to be working? So by 2028, this is where we are really at risk of, honestly, like a permanent uninsured underclass, and even among people that technically qualify, because it's just so difficult to cycle on and off coverage to, for the people to be like, oh my God, I just can't apply again, or that notion of how chronic illness and mental health issues just start to worsen. This is where I feel like we can start to play a role. So next slide. Oh, also do want to mention though, in terms of how this directly affects the young people. We already know, through the great reports of the Lewis Prize and many others, where it's like our CYD organization so much works with food insecurity, with education, with all sorts of transitions to adulthood. And this, this will start to affect those things. Another quote that I think is important that I really loved, this report that came out from Hope, which is, in their own words, Young Voices on Mental Health and the Future, talks about, young people who struggle to meet basic expenses report poor mental health at more than triple the rate of those who live comfortably. So you can see how this all starts to just domino in that, so what can we do? So one of the things is, Kat is going to be talking about the visioning, but really been thinking about, how do we reduce this administrative barriers and build a more culturally responsive system while reducing costs. This is going to involve simplifying access, integrating services, and honestly, this is a chance for us to truly diversify the workforce that has been needing to be diversified for a while. So next slide. This is a little bit of hope before Kat brings on the hope, which is that part of the watch party that Grantmakers for Thriving Youth was able to help to host was one of the first sessions was a beautiful one because it talked about how can we really, reimagine and review systems that are figuring this stuff out. So this is really about, how can we possibly make it more clear and easier for organizations and communities? They had these 3 different organizations present. I was very impressed with especially 2 of them, Mirza and my friend Ben, because it truly was sort of like, if you think about TurboTax or you think about the Common App, but imagine that for public benefits so that a person does not have to spend, these forms are so cumbersome. Mass Health, I just was helping a young person yesterday, 30 pages just for Mass Health. So basically, how can we have a system that will help to integrate these things and make the reporting so much less onerous for young people and for community members? And we do this by really focusing on eligibility, enrollment, and engagement. So we'd love to talk further to folks about this if they're interested. But, part of what was also brought up in these sort of TED Talk ideas of these 7 different organizations was that, every year over 140 billion in benefits go unclaimed because the systems are so fragmented and too complex. So improving access to these benefits would result in really billions of economic value. Okay, but now, after that bad news, we're going to hear more from Kat.
Thanks so much, Keita. And actually, she's giving me way more credit. This is really her leadership and work. I'm just talking through the slides. This is really just want to credit Keita. And she's been talking about this and gathering information and sort of like put it on my radar as well as somebody, as an organization that's like stepping into CYD, that this is so intersectional. This does matter. And like we need to be paying attention now. And as everybody on this call knows, is that, arts are often, I mean, they are a tool for solutions. We know, and young people as well have incredible assets and capabilities to bring solutions to problems that are existing right now. So, what we've heard from Keita is, again, these impacts are going to reach far and beyond Medicaid and SNAP. And again, the for young people in particular around the greater food insecurity and sort of disrupted access to healthcare and supports, that this ripple effects are going to show up across well-being and learning, community safety, and overall opportunity. And we know that CYD organizations are often where young people are finding the connection and stability and support. So again, these are things we know, and how can we, as funders, as a community, as advocates, start thinking about this now? What are the tools, radical imagination, radical collaboration that we can bring and start exploring now? That I was trying to describe this, like, that start seeding this, that we can, start spinning the wheel in a new direction, as, a longer term solution too, if we think about the impacts of these federal cuts, but couple it like, with more investments in CYD or social connection, art prescribing. Like we know, everybody on this call, the connection between arts and well-being. How do we leverage these movements now to think about a longer term solutions to there'd be lower healthcare costs, there'd be, higher value to arts and culture, all the benefits that this group knows. So if we could skip to the next slide. These are a couple of examples of a work that is already underway that we thought like groups coming together to build community and culture power. How do we partner with COBs? How do we COBs, I said COBs, CBOs, our nonprofit partners and the movements on the ground. How do we invest in community power building? So, sort of leverage the opportunities, connect some dots across, and really like what are the community solutions that we could lift up, amplify, etc. This is just one example. We just wanted to kind of put this in here. I'm sure several of you are familiar with this work already, but what we'd love to do is, again, sort of tap into your intel and your thinking. Please don't see breakout and think like, oh, I got to go get lunch right now. This is really, I think we've got enough folks here that we would love to just have some small group discussions. And we've got a couple of questions that we'd like to prompt with you. Again, the first question is like, what are the tools, opportunities, relationships, and, resources that would be most helpful for CYD for the philanthropy and funding community to provide at this time? I want us to think about like both immediate supports and also some of the creative solutions. Have you already been thinking about this? What else have you seen in your communities that has been working? Um, this could be flexible funding, navigators, trusted community partnerships, or other arts and culture strategies that have helped young people stay connected. And then the second question is, what are the near or longer term strategies or cross-sector partnerships that we should be considering as we reimagine a path forward? And I'm thinking about, again, Kathleen, thank you for being here too on the intersections from the youth development, thriving youth initiatives. But like, what are the cross pollinations between youth development, health, education, public benefits, etc. And where could stronger collaboration help seed some of the healthier outcomes for the young people over time? So that's kind of like just to spark some thoughts there. Katie, with her wizardry of Zoom, is going to help us break into some groups. And what we'd hope to in each group, if they could, facilitate, if somebody can facilitate, I think Katie and Keita and I will facilitate the conversations. But if somebody would be willing to volunteer as a note taker, and then somebody might be willing to volunteer as a report out as well, just to give some of the salient or talking points or ideas that were sparked there. So looking for volunteers on that. But again, stay with us. We'd love to do some breakouts, and then we'll come back and report out as a full group of just some of the things that we should be tracking. So Katie, work your magic.
Yes. All right. I'm going to send everybody out into the rooms and I'm going to set a timer for maybe 10 minutes in the rooms and then we'll have 10 minutes together back in the big group to share out. I just put the link in the chat for a shared document that Keita created where everybody can sort of keep track of their notes and ideas that are coming up in their group to help guide some share outs when we come back. All right. So I'm going to hit the button and we'll see you all in 10 minutes.
Okay, I'm ready to report.
Okay. We give 30 seconds.
Are we
30
ready?
seconds
Is everybody ready? Here we go.
So, Ebony, I'm so excited that you're coming to see David's harp.
Yes, I'm super
I
excited.
think you'll
I
be
had a
super
great call
impressed.
with them yesterday.
Yeah, I think you'd be super impressed with Brandon and his team. And DeLuge knows them as well. They invested a lot in the Lewis Prize, but very, very exciting.
Let's see. Yes, this is all of us. Welcome back, everybody. I know that time goes by way too fast. In our room, we really only started to scratch the surface of the first question, but definitely want to make sure we're respecting everyone's time. So I'm not sure who was group one, Kat or Keita, but whichever you do, you all want to do your share out?
I was, and I would invite Julia if you wouldn't mind just reporting out since you were just closing the last line in our conversation, just sort of like where we landed in our questions.
Yeah, we were lucky to have Kathleen there because she was able to frame it so well. I
Thank
mean,
you.
Kat too, but Kathleen's really been thinking about this. I think we landed on the at the very end just saying that these cuts are going to affect everybody involved in social services, human services, working with children, working with families. CYD is just one important sector, but there are a lot of sectors involved, and that one of the key messages here is engaging with all of these different areas of engagement and talking about what can you do to shore up your organizing and your community so that people understand what's coming down, and how can we collectively communicate about the impact and put in place systems to protect our families. How's that?
Group
Oh,
two.
Yeah, Daryl, I think that's you.
Yeah, so let me jump right in. Hopefully everybody can hear me. As part of group two, what we focused on is the importance of accurate information. Accurate information matters. Succinct communication is crucial. So making sure that whatever the legislation is, that is succinct, that it's clear, and also using technology to really connect with young people. We gave the example from Seattle of how technology is being used to help get the message across. And then last, we talked about the power of academia in terms specifically of having policy papers and being able to influence the national dialogue over the long term. So even though these laws are in place, there's still an ability to influence through policy changes down the line. Okay, who's group three? Is there a group three?
Yep, that's our group, and it's Deluge.
There is a group three. I'll just first say we didn't exactly stick to the questions. We probably focused more on question one than question two. But I'll just say that Katie, first of all, Katie had a good headline. Can you say that headline, Katie?
Yeah, let me pull it up to read my paper. So our headline is that we need to use our positionality as funders to convene, connect, and champion the impacts and solutions CYD offers and create the conditions in the community necessary to better support CYD and community arts organizations.
So just a couple notions on how that is happening or can happen. Conversation around building relationships with funders in other sectors, and particularly then creating examples that those funders can use as a kind of entry point to understanding the wider scope of what CYD really offers and delivers to young people. And then we talked also just about the kind of various states of disconnection that actually exist within the CYD practitioner environments, and then also within the funder environments.
Anything we missed or anybody wanted to add in there? I think I love the headline. I think that kind of summed up a lot of our work there too. We just need to keep this conversation going, and start now, starts today, if not yesterday. Matt, did you come off there?
Well, yeah, I mean, Ebony, when she first came on, it's a lot to unpack.
Yeah.
Right. It's a lot to unpack, both questions, but also the context of those questions within what's happening. Right. It can be overwhelming. It's like, where do you start? Where can you focus? And so I just want to name that because the needs are so great in every sector. And so I think as part of this work, focus is key. And where can we provide the most leverage to support organizations in our portfolio? Yeah, so I'll just say that it's Kate, I think you said, somebody says how like every or maybe Julia, every sector is impacted by this, but what's the uniqueness around CYD? What does it have to offer? And then how can we use our position to work with within the ecosystem of our communities to create the conditions around CYD to support them? Being cross-sector is critical, and leaning into cross-sector work is critical in all of this.
Matt, you saying that, it makes me think yes, there's these all these different sectors are being impacted, which means that the people that we all are working to support are being impacted in multiple different ways. They're getting hit from all sides. And so it's and I don't think there's ever been this confluence of impact to just their well-being in modern history.
And mindful of time, I think Katie, if you wanted to bring the slides back up, we do have some resources here, and we can share this out with the group afterwards. But Keita has done a running list, and just invite others that, as you're continuing to think, stay connected. Let's keep sharing resources and, reach out in between our calls too. I know on behalf of the steering committee, just feel free to reach out to any of us and share ideas or cool things that you come across in terms of collaborations and resources, so that we can start documenting and then sort of moving this forward. But yeah, I think Katie's got the resources here of some different links, which she also had in her other slides, which I believe we're sharing out too.
Is this showing the slide or is it showing something?
It is. It
Okay.
is showing the slide. So this is just a
Technical
short
difficulties.
list of the resources that we want to kind of build on too, just to kind of share, get that conversation going. And then I'll stop talking. And I think Daryl, you have some of our sort of closing remarks.
Yes, thank you, Kat, and thank you so much, everyone, for your input. What we're going to do with this is now take all of your headlines. We are going to have it documented. We'll pick it up again, potentially there in Albuquerque for those who are going to be there. So it's not going to be lost. All this time we spent here and the brain power that went into it, it's iterative. And then to Matt's point, and I guess Ebony brought this up as well, knowing where to focus. You can't boil the ocean, so we know that. So where are the points that we have some influence or control over? So this is the start. So we'll pick this up again for those in June who will be there in New Mexico. And I'll hand it back to, I guess, Matt.
Sure. Well, we'll send out the registration, the information about Albuquerque and AFTA. Hopefully we'll see all of you there, most of you there. And again, thank you for coming today and kind of sharing your knowledge, your resources. Kathleen, I just want to say that Hope Lab report's great, just kind of shows the social determinants of health impacting young people. So I think we just have to kind of take that approach as well, looking not just all the social determinants of health. But so yeah, I hope to see you in Albuquerque. Ebony, looking forward to see you at the end of April in San Diego, and hope to see some of you somewhere in between. Take care.
Good
Bye,
seeing you. Thank you
everyone.
for holding the space. Yeah. Bye.
Thank you.
Have a good day.